Good evening, Danielle. My name is Chris, and I'm the owner of Raw Performance Training Facility. Today I'll be conducting a short 10-minute interview with yourself, just to get a bit more of an understanding of your current exercise goals, as well as your medical and health background, if you've got any sort of underlying health or medical conditions that may need to be addressed before we can actually put together a specific tailor-made program that's going to suit your needs and hopefully get you towards your goals as quick as possible. How does that sound?
Sounds good.
Okay, have you done one of these interviews before? Have you had any sort of pre-screening questionnaires done at a gym before? Or is this the first
Yes,
time?
I've done this before.
Okay, cool. So hopefully some of these questions don't seem too foreign to you, and just please answer them openly and honestly. And if there's anything that you don't feel comfortable answering, just refrain from answering, and then we'll just move on to the next. Okay?
Sure.
Cool. So first of all, Danielle, I need to know a little bit more about you and your current training background. So what does your current training week look like at the minute? Do you do strength training, cardiovascular training? Are you currently a member of a gym?
I currently train 5 times a week, and yes,
Okay.
I am a member at that gym. I do 4 strength training sessions and 1 cardio session.
Cool. 4 strength, 1 cardio. So 5 days a week, and that's most weeks. That's a typical week, yeah?
Yes, every week.
Okay, cool. And do you like that sort of ratio and that split of strength and cardio? So predominantly strength?
Yes, I would like to run a bit more out with those training classes.
Okay, so on top of, you mean? You want to
on
increase
top
your running?
of.
Are you doing any of that at the minute? Are you currently running on
Now
top
and
of that?
again, but not consistent, just when I muster up the energy.
Okay, cool. So increase running on top of 4 strength, 1 cardio. And for me to actually understand if that is the right regime for you to be currently doing, I need to know a little bit about your goals. So strength training and strength improvement is obviously a main goal of yours, as well as cardiovascular improvement function. Do you have any sort of other goals, aesthetic goals, anything like that you might want to achieve in the gym?
Yeah, weight loss as well as strength.
Okay, so weight loss and strength. Now, I will dive into a little bit more detail with those two in a minute. Have you done lots of strength training before? Is this like a new thing that you've just recently started to do, strength training? Or have you been, are you quite familiar with weights?
Quite familiar with weights. I've done it for quite a few years.
Sure. So if I was to put a hierarchy of which is more important, weight loss or strength goals, which would be more important?
Strength.
Strength. So we'll put that as number 1 and then weight loss number 2. Are there any other goals you had in mind just for maybe overall well-being, mental health, anything like that? Or is it just mostly you just want strength and weight loss? That's the main.
Yeah, and increased fitness.
Okay, increased fitness.
I
We'll
feel
chuck
it's
that in there.
gotten worse as I've gotten older.
Sure. Is that why you want to try and maybe chuck in a couple more runs?
Yeah,
every
I
week?
like running and I want to do what I used to do.
Okay, cool. Do what you used to do. What was that?
Like time-wise and distance.
Sure.
Can't run the same distance the way I used to be
Cool.
able
So we'll
to.
set up a few goals in regards to maybe your kilometer splits, that sort of thing, yeah?
Yeah.
Okay, cool. So we might do some time trials with you and do some like retest when we get into it, just to see how you're going with that. Okay, cool. But number 1 being strength, so we will focus predominantly on lifting weights. In regards to weight loss, that will come down to your diet as well, so making sure you're tracking your calories, being in a calorie deficit. Now, what we need to do as well is we might liaise with some dietitians, sport dietitians. If that is the case, and if that is something that you're interested in, I might give you a little referral so you can have a chat to them, as I do work with a lot of allied health professionals that may be able to help you with your conducting maybe a specific calorie macro plan for you. Have you heard of like macros and counting calories before? Is that all kind of foreign to you? Yeah?
No, all familiar with that.
All familiar with that? Okay, cool. So at the end of this interview, maybe I'll pass you on their number and you can have a chat with them, as they will be able to get a little bit more in depth with that sort of stuff. Okay?
Sure.
But what I can help you with is definitely your strength training and your fitness. So 4 strength sessions per week and 1 cardio. That to me seems pretty good. I will break it down a little bit more into your specific goals in regards to your particular list, whether that be squatting, benching, deadlifting, what that might be, any sort of numbers that you might want to hit, and then we can develop like a periodized program, so just like a structured plan over the next 4, 8, 12 weeks and beyond, to make sure that we're on the right path to help you achieve those numbers that you want. Okay. So just to recap that, so it's going to be predominantly strength and then weight loss and fitness as your top 3 goals and top 3 priorities. Yes?
Yes.
Okay, cool. Okay, so what we're going to do first is I just need to make sure that your body is in good shape and in good health before we can actually go away, devise a program and present it to you, see if it's going to align with you and your goals and your times that you have to commit to. So we'll go over this quick pre-screening form. So basically all it is just, it's a series of questions that I'm going to ask you, and it's just going to let me know if you've got any sort of underlying medical issues that we maybe need to address before we can actually start training you. Okay?
Sure. Yeah.
Have you seen one of these before? Does that seem
Yes.
nothing that's too scary?
No.
Okay, cool. So firstly, can I just get your full name, please, Danielle?
Danielle Dewsbury.
Danielle Dewsbury. And your date of birth, please, Danielle.
070793.
7th of July, 1993.
Yeah.
Little Cancerian baby, are ya?
Yes.
Yeah. The hard exterior with the soft gooey inside, eh?
I'm female.
And you're a female, eh?
I
Okay,
am.
sure, we got that one correct. All right, cool. So, a few quick questions here. So, question 1. Has your doc or medical practitioner ever told you that you've had an underlying heart condition? Or have you
No.
ever had a stroke?
No.
Nope. Do you ever experience unexplained pains or discomfort in your chest or at rest during physical exercise?
No.
Good. Do you ever feel faint, dizzy, or lose balance during physical exercise?
Nope.
That's good. Have you had an asthma attack requiring immediate medical attention over the last 12 months?
Nope.
Cool. So your lungs are in good health. That's
They
good.
are.
Do you have type 1 or type 2 diabetes?
No, I don't.
And have you ever had your blood glucose, your blood sugar or your glucose levels tested in the last 3 months?
No, never had that done.
Okay, I think that's really important you get that done maybe every 12 weeks or so, I'd say, just to make sure that you are erring on the side of safety, because type 2 diabetes can bite in the ass quick, and it can get you if you don't stay on top of that. So maybe we'll get you to do some blood tests soon. Do you have any other conditions that may require special consideration for you to exercise?
No.
Not that you know of.
Not that I know of.
Have you ever had a medical clearance before you started commencing any sort of training program?
Nope.
Okay, cool. Well, based off this so far, we don't need to get you to, we don't need a referral to the doctors yet, but there's a few more questions that I need to ask, and then we can carry on with getting into your goals, okay? Mm-hmm. So, your current physical activity levels, you said 5 days per week, okay, with a couple of runs. Mm-hmm. And we need to break them down into either light, moderate, or vigorous intensity, okay? So I'll just show you this little chart here. So light activity is 40 to 55% of max heart rate, which basically means just a light walk where you can maintain a good conversation. So if we're just walking down the park, that would be light. Moderate is 55 to 70% of your max heart rate, which is somewhat hard. So you can sustain it for maybe 30 to 60 minutes, and you might just start to struggle to talk and maybe be slightly huffing and puffing. Vigorous is 70 to 90% of your max heart rate, and that is where you will be not able to do it continuously for more than 30 minutes, so you'll be fairly out of breath, like going for a run. And then high intensity would be basically an all-out sprint, balls to the wall sort of thing. Okay, so judging by that chart there, how would you break down your training into how would you break down your weekly training into those categories there?
That's a hard one because I actually am really out of breath when I strength train sometimes.
Sure. So I put that down to moderate to high, I'd say. So let's err on the side of caution and go moderate. Okay. So would you say your force strength would be then moderate? Or
Yeah, and then the cardio is definitely high.
Cardio is high, so 1 high. And is that 60 minutes in duration?
Yeah.
45, 60? All of them, strength and cardio?
The cardio one's maybe 40 minutes.
40 minutes. Okay, cool. So what we'll do here is there's just like a little equation, okay, just to give you your weighted physical activity exercise per week. So 4 by 60 equals 240, and then when you train in the vigorous to high intensity, you get double the points. How good? So that will be then 80. So 80 plus 240 gives us 320. So that would be 320 minutes per week. That's your calculated weighted physical activity exercise for the week. And based off these guidelines, if you are more than 150 minutes per week, we can continue with your current physical activity regime at those intensity levels. Sorry. So we can keep you exercising to a moderate to high intensity throughout the week. Okay, which is good. Tick. So, moving on. These are just the last few bits and pieces that I need to ask you. Now, this is just going to dig a little bit deeper into your medical background before we can actually give you the tick of approval and start writing up your programs. Okay.
Sure.
So, how old are you? First of all.
31.
31. Spring chicken, eh? You're female, yeah?
Yes.
Have you got any family history of heart attack or stroke?
My granddad.
Your GPAR, okay. And what age did that actually occur?
50s.
In his 50s, so I'll just say like 55,
Yeah,
mid-50s.
something like
that. Do you smoke cigarettes, vapes, social smoker?
I don't, but I definitely did.
Definitely did.
So
So
no.
currently, no?
Currently, no.
Okay. Did you quit within the last 6
Oh,
months?
and have you quit smoking? Yes.
Okay. How many were you smoking when you were smoking? Be honest.
Honestly,
no.
like, I would take maybe 10 puffs of a vape a day or something.
10 puffs of a
don't know how
vape.
you measure
Well,
vape.
that's all right. I'm just going to write that down just so
Yeah.
I know. 10 puffs of a vape.
Yeah. I know, not just.
Moving on. Okay, so body composition. If you don't mind me asking, what is your height and weight?
Weight 77 kg.
77 kegs. And your height in centimeters?
177.
177.
I'm not sure of those.
So we'll do a little BMI calculation here. Okay. Have you ever had your BMI done before?
Yes, quite a few times, but I cannot tell you what it was.
Okay, so basically it just gives you like it's called your body mass index. So based off your height and weight, there are guidelines or categories saying if you are underweight of a healthy weight range, overweight or obese. And these are just categories that you're going to fall into. So I'll do your calculation now and see where you're at. Have you done it before? You said yes.
Yeah.
Okay. Now remember, this doesn't take into account muscle mass. So take it with a pinch of salt. It is a good guideline, but I would always take it with a pinch of salt. If you've been doing strength training like you have been, your muscle mass might skew the results to be slightly elevated. Okay, so
Yeah.
don't get scared when I give you your answer. Okay, so we'll just do this for you now. Okay, so
So my weight's 77.
77. How do I do brackets on here? That's the question. What I'll do is I'll just do. How tall are you? Sorry, Danielle.
177.
177. 3.13. Remember that number. So. Okay, so your BMI is 24.5. Okay, so if we have a look here, that will put you into the normal weight.
Oh, great.
On the upper limit, okay? But it's still good. You were nervous then when you're like, ooh, heart was pounding. So that's pretty good, especially because you lift weights as well, so you're super healthy, okay? According to these guidelines. So how good? Great, so your BMI 24.5, perfect. Do you know what your waist circumference is?
Oh, I do not know.
That's all right, we can do that at another time, do not stress. Have you been told that you have high blood pressure before?
No.
Nope, that's good. I'll do that with you in a sec as well. So basically, have you had it done before? Put the cuff around your arm. Yep, it's going to tell you exactly the pressure in your arterial walls when your heart's beating and at rest. Are you taking any meds for high blood pressure?
No.
You probably wouldn't be because you've not been told that you've had high blood pressure. Do you have high cholesterol?
Nope.
Cool. Are you taking any meds for this? Obviously not. Have you been told that you have high blood sugar?
No.
You said no before already. Cool. Obviously no meds. Are you currently taking prescribed meds for any condition that we've not spoken about here? So anything under the sun that I may need to know about?
No.
Are you on contraception, anything like that?
Oh, right. Yes.
Okay. Yep. So that is the
ICU? I can't remember what you call
it's
it.
the Marina, is it? Is that what it is? Yep, the Marina, something like that. Okay, cool. Anything else that you take? No?
No.
Okay. Have you spent time in hospital in the last 12 months?
No.
No? Okay. Cool. Are you pregnant?
No.
God. Do you have any muscle, bone, tendon, ligament, or joint problems?
No.
Okay. Great. All right. That is that form done. Tick that box. How did that feel? That wasn't too scary?
No, great.
Okay, cool. So basically, from what I can see so far, there is absolutely nothing to stop us undergoing any sort of exercise regime or programming. So that's good. You seem pretty fit. You're pretty healthy as far as I can see. So I think we're ready to get stuck in and develop your program based off your goals. I do need to let you know that before we undergo any sort of training regime, there are some risks involved. Musculoskeletal, so you can maybe tear a muscle, hurt your joints when you're lifting heavy weights. So I just need to make sure that you understand that. Obviously, I believe that the risk definitely the reward outweighs the risk significantly, as it's the benefits from strength training and cardiovascular training go on and on for cardiovascular health, heart health, bone density. Actually helps your bones stay nice and strong so you won't break them when you fall over, that sort of thing. Keeps you super healthy, keeps all your blood lipids and your blood markers in check from exercising regularly. Okay. What else do I need to tell you? That's pretty much it, I think. Thank you for taking, sorry I took a little bit more of your time, 16 minutes, but thank you for taking the time out of your day to have this chat with me. Were there any other questions that you maybe had before I go away and start creating a specific exercise regime for yourself?
No more questions.
Sure?
Yeah.
Okay, thank you so much for your time, Danielle.
Thanks.
And I'll be in touch within the next week once I go over your program. Okay?
Great. Can't wait to hear from you.
Cool, thank you.